speaker is Jacquely Rutchik of New York State Nurses Association.
Hey everyone, thanks for meeting today. It's really encouraging to know there's so many of us who are fighting to protect essential workers during this time. I'm a registered nurse. I work at Health Alliance Hospital in Kingston. I was born and raised in Dutchess County. I went to Dutchess Community College and got my degree in 2016. And I live over here in Kingston now. I am on our local bargaining unit's executive committee. I'm the vice president, and I work alongside about 400 nurses in our unit here. I work on the COVID-19 medical floor, so I've been certainly seeing some things firsthand that are disturbing and are definitely affecting me spiritually, mentally, emotionally. There's definitely some things that are still true that we need from 2 months ago. First, I do want to say what I'm proud of, and that's all my union nurses and all the coworkers in healthcare that have been stepping up, taking care of patients during this crisis and doing it without the proper protections. We're risking our lives because we truly care about our patients, but it shouldn't be that way. Like I said, this crisis is taking not just a physical toll, but a mental and emotional toll on us, especially as we realize that our employers and our government aren't doing as much as they can to protect us. So the challenges, like I said, they're the same that they were 2 months ago. We don't have enough personal protective equipment to do our jobs. So hospital administrators, they'll tell you that it's adequate, but if you ask me, if you ask any of my coworkers, we'll tell you the truth. And it's just not enough. It won't be enough until we return to science-based guidelines for safe use of PPE instead of dangerous conservation guidelines that are based on supply chain issues. Right now, we're having pressure to restart elective surgeries as early as next week. And pressure to reopen the state at large. But there's so many actions at every level of government that need to be accomplished before we can safely do that. So Congressman Maloney, you have influence at the federal state level, and that's where we need the next stimulus bill to provide significant funding to New York State. We are the global epicenter for this disease. Our state alone has more cases than the entire country of Spain. So yeah, we need that federal funding. And we also need that bill to include protections for frontline workers like paid sick leave, worker compensation, OSHA protections. Because for essential workers, this is an occupational hazard. It's an occupational disease. So the war is not going to end if we don't fund and protect those that are battling it head on. And at the state level, Senator Metzger, we need you to stand with essential workers who are rejecting state budget cuts to fundamental services like healthcare and education, because nurses especially know the consequences of those types of cuts to our communities. And that leads me to another point of consideration, that nurses need to have a big say in how and when we reopen, because we put public health and safety first. And our voices are going to be the ones that truly protect our community and help us stay out of this crisis when we do finally win and not have another resurgence. And at the county level, Executive Ryan, I have something a little more specific to ask of you and to ask for your support in the return of mental health and detox services to Health Alliance Hospital. Because we have Ulster County patients having to travel to Poughkeepsie now for these services ever since Mary's Avenue was closed down by the state. And that's creating a barrier to care that shouldn't exist, especially in this time when we're all facing unprecedented stress. We have to have these services to support our community, not just medically, but mentally and emotionally as well. I know that all three of you have really been working so hard, and I truly appreciate your service. I do have faith that you'll continue to fight for us, just as I'm always going to fight for my patients and my coworkers. And I just want to thank everyone on this call for your service and all of your various unions, and to just keep up the good fight.
Thank you so much, Jackie.